us. Today we have a very special guest. Dr. Inna Husain is joining us. Dr. Inna, thank you for being here. If you're new to Dr. Inna, she is a world-renowned otolaryngologist. She has been published in over 40 peer-reviewed articles. She's trained at Northwestern and Harvard, and she's a specialist in all things ear, nose, throat, airway, and LPR, reflux. So we're going to be talking about, how do we navigate reflux, LPR, GERD, surrounding the holiday season. And yeah, I'm excited to dive in. Thanks for being here, Anna.
Yeah, thanks so much for having me, Molly.
This is definitely a topic I'm seeing coming up in my clients. Just some anxiety around the holidays, even with just lots of holiday gatherings, food maybe being out of our control. Is that something that you're also seeing in your population of patients?
Yeah, 100%. I mean, the holidays can be such a joyous time, and I think that's what we try to focus on, but the reality of the holidays can be incredibly stressful.
Absolutely. Yeah. Yes. And if you've watched any of our previous interviews together, we often touch on stress. And so absolutely. And that's in the title of this live is stress that can really impact reflux symptoms. Is that something that you see as well?
Yeah, 100%. I mean, we know that there are physiological reasons why stress can cause manifestations in the body, specifically with digestive health, with reflux. And so we are seeing a lot of symptoms of things like LPR, silent reflux, even traditional reflux get exacerbated during this season.
For sure. Yeah, absolutely. Stress is a big one that I see impacting symptoms for my clients. And so we talk about, when you travel or when things are busy, you might not have your typical routine. Things can kind of get shifted off. So if you're used to doing maybe some stress management strategies like meditation or yoga, you might be not necessarily engaging in those as much. So I like to incorporate what I call nervous system snacks. So little moments throughout the day where you're sort of taking a break, especially when you're running around with holiday errands or holiday parties, taking even like 5 deep breaths after a meal, which the diaphragmatic breathing can help prevent reflux after a meal. So taking a breathing break, taking a break outside, a stretch break, or even just, calling a friend and making sure that you're taking care of yourself from a stress perspective around the holidays, I think is really key.
That's really important. A lot of times, a lot of what we both do when we're talking to patients about reflux is talking about kind of the role of diet and lifestyle, natural remedies. The reality is, during the holidays, it's really hard for some patients and clients to kind of stick to what they've been doing through the years because of the holiday dinners and the get togethers and so much how we socialize and express our love for our family. It sometimes have to do with meal times. And so sometimes there can be deviations from the things that we've incorporated into our lifestyle to help with our reflux. So a lot of times during this season especially, focus not so much necessarily on the what, but more like the how, right? And so, if there is some delicious dessert that mom always makes, I don't necessarily say, well, you can't try it, you can't taste it, but I say, how about we focus on the amount of it you have then, right? If you're going to have a bite or two or a small plate, let's kind of focus on the amount because we know that stomach distension can cause reflux in multiple ways, right? So the sheer mechanical distension can move things upward, which we call reflux. But distending the stomach walls also kind of causes gastrin, which is a hormone, to kind of get excreted, which can then cause more acid production. And so the quantity is something I focus a lot on with patients in terms of trying to make realistic changes, perhaps, or things that they can try to address.
I love that. I love that. That's something that I always speak with my clients about as well. And similarly, some of my clients that have been, making progress in reducing their GERD or LPR or reflux symptoms, they're, feeling like, oh, well, I'm going to be thrown off by these holiday events and I really do want to enjoy these traditional foods.
Mhm.
And I say the same thing. Like it's really important. Sometimes it's even more important how you're eating versus even what you're eating. And so thinking about the portion size. And it is so much easier when to be satisfied with a smaller portion if you're fully present at that meal. And so being like really present, savoring each bite, chewing well, kind of slowing down and keeping the focus on, in the moment with your friends and family, enjoying that food so much easier to really feel satisfied with a smaller portion if you're present during the eating experience. So,
Yep.
mindful eating is really helpful for reflux in all sort of scenarios, but especially the holidays where we might not be able to control what we're eating, and the foods might be higher in fat, containing certain reflux triggers. But if we can keep the portion size small, and we can also eat consistently throughout the day. Like sometimes I see clients skipping meals throughout the day, or maybe like saving up calories or avoiding food because they know they have a holiday dinner. That's really not the approach we want to take when it comes to reflux. We want to continue to eat balanced meals and snacks that we know work well for you, so that when you get to this holiday dinner, you can eat in a comfortable portion and you're not like ravenous, and you feel like you're going to be out of control with food, because we can get that over fullness, which definitely can trigger reflux.
That's definitely a great point. I see that a lot too, where patients think I'm probably better off just not eating anything, and the truth is, you still produce stomach acid whether you eat or not. And now you've basically created a void of anything else in the stomach to kind of sop some of that acid up. So sometimes symptoms can actually be worse with the method of kind of like starving or skipping meals. Hunger often doesn't go away by doing that; it only gets worse. And like you said, it's very difficult to be mindful and present when you are starving, right? It's very difficult to make those choices when you are hungry.
For sure, and your brain can't get that fullness cue if you've gone into this ravenous state. It can be really hard for your brain to acknowledge the fullness cue, and so um, and sometimes we're not perfect eaters. So we can do all of these things, and then in all these things right, eating balance throughout the day, slowing down at the meal, and sometimes we accidentally eat past fullness and it happens. And so I have been talking to my clients lately about having their kind of reflux toolkit with them. So having an alginate, like the one I use is Reflux Raft, and having that alginate barrier that you can take, which an alginate is just an algae supplement that you can consume after a meal, and it creates a little gel raft at the top of the stomach to physically prevent reflux from moving upwards. So that can be like a really supportive tool post meal if you've eaten past fullness.
Right. I completely agree with you. I also am really a big fan of Reflux Raft as well. It's all natural, so we don't have to worry about, the risks of kind of chronic acid suppression. It's something that can be used on an as needed basis. Again, we can be really strict with our diets, and, one deviation shouldn't make you feel horrible. There's support. It's something I say it's can be, again, part of your toolkit. I actually, funny enough, have some with me here because I suffer from reflux as well. This is their newest flavor, so super excited about this one, Berry Burst. Their original one was lemon ginger. So it's great. It's something for everybody, that can be used after meals, used before bedtime in an all natural way. And so there's hope. You shouldn't have to worry that, oh, I accidentally had too much to eat. What do I do now? There's something you can do.
Yeah, for sure, for sure. My clients always ask me too if I still use, reflux support or medications or alginates, and I do when I travel, especially for the holidays. I always take a little squeezy bottle of Reflux Raft. You could just, get a travel squeezy bottle, put the alginate in there, because I know I'm going to be eating late. I know I'm going to eat past fullness at some point, and so having that with me so that when I lay down, if my stomach isn't fully empty, I know I have that protective barrier. So it is something that I still utilize for the evening time. And I think it's really, really helpful. Also, posture during a meal. If you've had a really large meal, making sure that we're sitting upright. If you can go for like a walk afterwards, if you can control when your meal time is, having it about 3 hours before bed is ideal. We can't always do that, but if you can, eating earlier is also a great tip for the holiday season.
And we always talk about, trying to reduce stress. How to reduce stress, I probably wouldn't have to work, right? Like if we had some easy fix for that. But there's lots of ways in which stress makes all of this so much worse, right? So it increases, again, gastrin production. We talk a lot about the gut brain axis. So what your brain is kind of feeling or dealing with can directly affect the gut microbiome.
Oh, I think we lost her.
Oh no.
Oh,
I'm
you're
back.
back. You're
I'm
back.
back. I was saying, yeah, so stress can slow down digestion, which can then
Yep,
cause mechanical upward reflux. It can have effects on the gut microbiome, which I think is a very, very fascinating area of research. And then we've all heard of stress ulcers, right? So these are real manifestations, and again, lots of stress in everybody's day-to-day life with holiday travel, holiday get-togethers, shopping, all of that can exacerbate it. So I always tell my patients, like, kind of sort of prep that there's going to be a little bit of that, but we have kind of tools and things that we can recommend for you to help you get through it.
for sure, for sure. Yeah. So incorporating kind of some of those maybe even 1 to 2 minute nervous system snacks throughout the day. There's a free playlist on the Flora app too, free meditations that people can use. Um, and then noticing kind of where does your stress pop up. So this is a
Mhm.
conversation I'll have with my clients. Is kind of like where is most of your stress coming from, and if we can mitigate that, if we can ask for help, if we can plan ahead for your nutrition to make it less stressful. If we can ask for help with these holiday parties or time management better, a lot of times it's the pressures of the holidays and having so much to do that it's leading to some of that stress. Or maybe it's dealing with certain family situations, and so making sure that you're supporting yourself there with going in with a positive mindset, establishing boundaries if you need to, taking care of you, whatever helps you reduce that stress cup. We want to try to prioritize that because if you take care of yourself, you're going to show up so much better for everyone else around you. So, really kind of remembering that, giving yourself that gift of self care during the holidays is important.
Wonderful. I agree.
And then when it comes to sleep, that's another thing around the holidays that can be tricky. Maybe you're traveling and you're jet lagged, or maybe it's just been so busy that you're not necessarily prioritizing it. And sleep can absolutely impact reflux.
Definitely. There's a lot of correlation between, I mean, in both directions, poor sleep and reflux, right? Poor sleep quality, especially in the form of like obstructive sleep apnea, can really trigger a lot of mechanical movement, again, known as reflux, and vice versa. Having uncontrolled reflux, it's very uncomfortable to get a good night's sleep if you're actively feeling reflux. So, very intimately connected there as well.
Yes, yeah, for sure. From a nutrition perspective, I already mentioned trying to eat dinner about 3 hours before bed when possible, thinking about getting, front loading your day with nutrition, trying to make breakfast or lunch or larger meals. But I also love using, we talked about Nalginate before bed, but also melatonin. There is research on melatonin and its supportiveness for reflux. It can help tone the lower esophageal sphincter at night. And so that's something that I think can be really helpful. Can also help with jet lag. So if you're traveling, this could be something really helpful. And there is a reflux raft flavor that has melatonin in it, so you could kind of do double whammy like that. But that's something that some of my clients will utilize around this time of year.
Yeah, I a great point. I love melatonin for reflux patients because of that direct effect on the lower esophageal sphincter. So you're essentially treating reflux, not just trying to suppress acid. And reflux raft having that melatonin version, I mean, it's a game changer. It is so unique to the market, what's available and what's out there. For those of you looking to do some holiday shopping, they are currently having a 20% off on that bundle, the berry bundle, which is really awesome. Perfect timing. But yes, definitely. I mean, having a little bit of that support at night can be especially helpful. Position makes a big difference. So we often talk about the kind of elevated head, which isn't just like two pillows behind your head, it's actually more of like a ramp or a wedge style pillow. Some patients will actually lift the what do you call it, the head posts up a little bit, put it on blocks, which can be helpful, or then sleeping with your left side down. So the left is the stomach. And so sleeping down kind of uses gravity to your advantage to help reduce mechanical reflux.
Yeah, really good tips, really good tips. And then that can help you sleep better, and then that can help reduce stress. I know for me, if I don't sleep well, I feel like my stress level is is higher the next day. So getting good sleep can help you with the stress piece as well. So it's all, and then can help with reflux. So it's all really connected.
It is. Yeah, definitely. I feel like my ability to handle stress is definitely reduced if I don't get a good night's sleep.
That's for sure. And also food choices. Food choices can be tricky, and we can have more cravings if we don't get adequate sleep. So, I think, keeping these front of mind is important, and we can all use reminders in these areas. And when it comes to your social circles too, letting people know kind of what your goals are. If you want to let your friends or partner know, I'm really trying to prioritize stress management or sleep. Can you hold me accountable in these ways, or can we squeeze in a yoga class like among all these holiday parties, or maybe kind of letting them know what your goals are. I think is important to have that conversation.
Right. Use your community, your support networks for this aspect as well.
Yeah, for sure. Awesome. Well, I will link Reflux Wrapped and Dr. Inna's profile down below if you want to find out more about Dr. Inna and her work. And thank you guys for joining, Antonio and everyone. Thanks for commenting. It's so nice to see you guys. And if you have any questions, or if you have any topics you want us to talk about in our next live, we try to do these monthly. So let us know if you have any topic requests down below.
Great, great. Thanks so much, Molly. It's great chat as always.
Yeah, great to see you. Thank you
You
so
too.
much for your time, and talk to you soon.
Bye.
Bye.